For sake of simplicity, we're going to just focus on the Candida piece in this podcast, though.
Yeah, let's just talk about a number though, real quick, just for the curious mind listening to the podcast. I want to get your number. I'll tell you my number, which is I would say 90 to 95% of people with Candida have some other infection at the same time.
Yeah, I agree. Yep. It's very rarely just Candida. I see a lot of people that think it's just Candida, but like you said, I think that's in the minority. I like the Pareto principle. So 80-20, so maybe 20% for me is just Candida, but right in that area, I think is pretty reasonable.
Yeah. All right. So let's get back to causes here. So drugs are like the biggest umbrella, but let's break some of those down.
So number one medication is going to be antibiotics, right? Antibiotics are going to knock down bacteria to a very, minuscule degree, but then you have what's called the rebound fungal overgrowth. And a lot more of the doctors are actually starting to get in tune with this. Well, they'll actually use specific probiotics and even Saccharomyces boulardii, which is a beneficial yeast that prevents Candida from overgrowing. So a lot more of the cutting edge medical doctors who understand the side effects of these drugs are recommending probiotics and specific beneficial yeast preventatively. That's number one. So it's going to have that rebound overgrowth. Ideally, number two is make sure you really actually need the antibiotics. A lot of times there's a natural alternative that you can go to that'll be just as effective and more safe. So there's that. And I'd say the next thing after that, I see it very frequently with women on birth control. Birth control pills tend to more have an alkalizing effect on the urinary tract and the vaginal canal. People think, oh, alkalinity is good. Well, not really, because probiotics, like the major probiotic that we know of is Lactobacillus acidophilus. What does that mean? Acidophilus literally means acid loving. So there's various acids that are produced by beneficial bacteria, and those acids make it harder for yeast to grow. So when you start to alkalize that urinary tract and vaginal canal, it actually makes it easier for yeast to grow, because the acids have natural antimicrobial effects. So when you decrease the natural antimicrobial environment, it's easier for critters and yeast to grow.
Well, it sounds like what you're saying is in that case, then proton pump inhibitors, acid blocking medications would also further increase Candida, because now you're dropping down stomach acid.
Yes. And then here's kind of like another component, right? So we know birth control pills are going to typically drive up estrogen. They're definitely going to promote estrogen dominance. We know estrogen dominance is also going to do what to our gallbladder? It's going to make our bile more sludgy and not flow as well. And what does bile have? Bile has a natural antimicrobial effect as well, right? Various bile acids, right? So if we don't have enough bile, now we don't break down fat. And then the bile acids aren't in our digestive system to help provide an antimicrobial environment. So now it starts to allow SIBO to grow as well. So now bacteria starts to overgrow. So you can see how these things can really spiral out of control.
Yeah, we got a few more drugs to talk about, but then also I want to try to circle back to the gallbladder, even just someone who doesn't, I guess I'll say it now just to get it over with. Someone who doesn't have a gallbladder. We've done many podcasts on bile and increasing digestion and improving digestion, but it sounds like along this same vein here, someone without a gallbladder, they're going to be at a much higher risk of a Candida overgrowth.
Yep. And then if you're a female and you have estrogen dominance, right? And you know this because you start to have maybe excessive bleeding or a lot of symptoms leading up to your period, breast tenderness, mood issues, back pain, cramping, the whole 9 yards. That's a sign that you're moving in the direction of estrogen dominance. And then there's going to be potentially sludgy gallbladder bile flow, which then opens you up to more Candida issues on the backside. So it's like everything's kind of connected. So when people who are listening to this, if you're working with a good functional medicine doctor, you want to make sure they're going upstream and trying to connect all the different dots. Because if you're just seeing someone that's, oh, I'm just putting Candida in my crosshair and all I'm focused on Candida, and I'm not looking at the upstream effects, bile flow, HCl, foods, medications, other infections, you could really miss some really important barriers that would help with healing.
Yeah. So the goal is not run out to Whole Foods or wherever your doctor's office and grab your oregano oil and start popping it. That's not going to be the strategy here.
Exactly. So obviously, next thing we could talk about, we mentioned the medications, we mentioned birth control pills. I would just say refined sugar, refined carbohydrates are going to be a big one. I mean, some people are getting really nuanced and talking about ketones being a driving factor of Candida. I typically am not seeing that as being a driving factor of Candida. Acellular carbohydrates are much easier to process and much easier to fuel Candida and yeast. Is it possible ketones could, generally speaking, 99% of patients I see with Candida or yeast overgrowth, there's a history of a lot of refined processed carbohydrates leading up to it.
Yeah. There was several other drugs that, I mean, we could go on and on about drugs. Uh, I'm sure we don't have any papers on it, but like the fluconazole, we talked about how that made candida problems potentially worse. The funny thing is that's exactly what people are getting treated with. And so it's almost like the drug is making this problem worse. And now you have this phenomenon of the antifungal resistance that the Center for Disease Control's warning people about, which is the same thing we've seen with bacteria. So now you've got all these antifungal resistant strains running around. So I just want to hit on the drug piece just one more time, and then stop talking about it, which is the fact that the very treatment you're getting is potentially making this worse. So if you keep going back on diflucan, nystatin, fluconazole, that could be part of the reason you're not getting better.
100%. And then also, we live in an environment where people are just more inflamed, right? So if you go to your conventional medical doctor with symptoms of inflammation, what are they going to typically prescribe? They're going to prescribe corticosteroid medications. Well, those corticosteroids, one, they're catabolic, they'll break down tissue, so they'll probably make your problem worse if used chronically. Acutely, it may be okay. But what do corticosteroids do to your blood sugar? They increase it. And then when your blood sugar, your blood glucose goes higher, what does that fuel more of? It fuels more candida. So being on corticosteroids chronically will actually increase your chance of more yeast issues as well.
Did you know the Center for Disease Control, they actually made what they call emerging infections program, and candida is in that emerging infections program because they're saying that the candida is becoming more virulent, it's creating more problems, they're seeing more resistance. So candida, like you kind of mentioned, that it's really kind of ignored and maybe you'd get blown off if you brought that up. It's becoming more and more mainstream now because we're seeing the rise of it, and we're seeing so many more people in hospital settings.